Welcome to the video. In this video, we explore the recent outbreak of Human Metapneumovirus, HMPV, its symptoms, and how it spreads across various countries. So let's jump it. In late 2019, a new virus known as COVID-19 or coronavirus spread widely in Wuhan, Hubei province of China. Eventually, it turned into a pandemic, spreading across the world and claiming the lives of millions. A global emergency was declared, and lockdowns were imposed worldwide. Just as the world began recovering from the COVID pandemic, a new virus called Human Metapneumovirus, HMPV, has recently spread rapidly in northern China. This virus was identified here for the first time like COVID. Health experts have warned that the virus could become as severe as COVID. Many specialists fear that a new pandemic like corona could emerge in 2025. Although it is unclear which disease might take on a pandemic form, the outbreak of HMPV is raising concerns. Michael Head, a senior researcher at Southampton University in the UK, stated that there is a risk of another pandemic. But since the specific disease remains uncertain, the potential pandemic has been provisionally named Disease X. Diseases like measles, cholera, bird flu, and scabies are among 11 potential pandemic threats. The recent HMPV outbreak has already raised concerns among medical and public health experts. In China, respiratory illnesses have surged significantly, with a notable rise in patients infected by HMPV. The Chinese Center for Disease Control and Prevention, CCDC, described HMPV as an influenza or flu-like virus and noted that while it is unclear whether the virus is fatal, it can easily infect people of all ages, particularly children and the elderly with pre-existing respiratory conditions. Not only HMPV, but multiple viruses have been found in patients affected by the new outbreak, including the H5N1 variant of influenza A, Mycoplasma pneumonia, and even traces of COVID-19. China's National Administration of Disease Control and Prevention has urged people to follow public health guidelines. The sudden rise in respiratory illnesses across China has reminded many of the COVID pandemic. After China, the virus has also been reported in Malaysia, where the infection rate has increased by 45% compared to last year. The Malaysian Ministry of Health has advised the public to take precautions. Reports of HMPV infections have also emerged from Hong Kong. Neighboring Japan is experiencing the spread of this flu, with nearly 100,000 flu patients identified in the past week alone, 5,000 of whom required hospitalization. Japanese media reported that over 700,000 people have been affected by cold-related illnesses this season. Awareness campaigns are underway to curb the virus's spread. Following China, Malaysia, and Hong Kong, cases of HMPV have now been reported in India. In Bengaluru of Karnataka state, the virus was first detected in children 1 year of age. The virus has also spread to Ahmedabad in western India, Nagpur, Chennai, and Kolkata, raising concerns about its rapid transmission across the countries including China. HMPV becomes more active during winter, making respiratory infections more prevalent during this season. Children and the elderly, with weaker immune systems, are at higher risk of infection. Human metapneumovirus was first identified in 2001 in the Netherlands by Bernadette G. van den Hogen and her colleagues. It was initially detected in respiratory secretions from 28 young children in the Netherlands and was found to be distinct from other common respiratory viruses. The virus spreads through direct human contact or by touching surfaces contaminated with it. The U.S. Centers for Disease Control and Prevention, CDC, tracks HMPV cases similarly to other respiratory viruses. As a respiratory illness, HMPV shares symptoms with COVID. Infected individuals may experience fever, cold, runny nose, cough, sore throat, nasal congestion, and breathing difficulties. In severe cases, complications such as bronchitis, pneumonia, asthma, or ear infections may arise.